Hey, Ms. Wright.
Hey,
Good to see you
Doctor.
again. How are you?
I'm about the same as when I saw you the last time. I still got a lot of pain.
A lot of pain. Okay.
Yeah.
Well, we refilled your prescription at about the same dose. Tell me on that scale of 1 to 10, what your average pain level has been over the last week.
I'm telling you, it's 9. That's why that same dose is just not enough. But I'm saying 9, even with the medicine.
Yeah. And you were at 8 last time, so it's actually a little worse, you think, than last time. What about your enjoyment of life on that same scale of 1 to 10? How much is the pain interfering with your
life?
You don't have a life. Tell me a little bit more about that. That sounds tough.
I mean, here it is, doctor. This is the way it is. I go to work, I come home, I eat supper, I take a shower, I go to bed, I get up, if it's a good day, I go ahead and go to work and come home, take a shower, go to bed, and I don't have a life. And the days that I'm not working, I'm sleeping.
Wow. So I don't know if you gave me a number. On a scale of 1 to 10, how much does that interfere then with your ability to enjoy life?
I think about an 8 at least. I mean, I see other people, they got a life and I don't. We all get one life and this is mine.
Wow, that sounds tough. Let me ask you one other thing. What number best describes how during the last week the pain has interfered with your general activity?
1 to 10?
1 to 10. How much does it
At
interfere?
least a 7. I told you I go to work. I get up, I go to work.
You missed any work?
No. One day I did. I did, but I push myself.
So you can work, but not really anything else.
I don't go out with friends. Someone invited me to a wedding last week. I didn't feel like it.
Yeah, okay.
I don't.
Well, we had talked about trying some other things last time. I think we talked about some yoga. Did you have a chance to do that?
No, I didn't. I tell you what happened. I was planning to do that, but what happened is my friend was sick. She's the one that's been inviting me. She's sick. I didn't want to go by myself, and I'm a little bit worried. I think you have to pay like $30 a month if you're going to join to take the class, and that's a little bit expensive for me. And I don't know if that's going to work. I don't know if that's going to help me. I'll be honest with you, because I mean, stretching here and there and all that, I don't know how that even relates to my stomach, but
So you have some doubts about whether it's going to make any difference.
I do, but I mean, I was gonna go, I just didn't. It just didn't get to happen this time.
Well, could I just talk to you a little bit more about why we think it works and how?
Yeah.
Last time you mentioned to me that when you get active, you have less pain. So part of that is just distracting and focusing on other things. And you mentioned
that's true.
that when you do deep breathing, sometimes
Yeah,
that helps
that's
cut
true.
the pain.
That's the only thing.
So there's some things, there's some
That is-
kind of mind-body
yeah.
connections that by focusing on other things, learning techniques, there's a lot of deep breathing in yoga. That the studies show that people with chronic pain, if they do yoga, many of them, their pain level goes down and their quality of life goes up. And that's what we'd really like for you. We don't just want you to
they've
take
actually studied that. They find that's true.
for people with chronic pain.
That's surprising.
So, you know, our goals here are to get your pain level down, but we really want to increase your activity level. We want you to enjoy life. And so that's why thinking about some of these other things besides taking pills really might open a window for you, a door to hopefully a more enjoyable life.
That'd be so good.
You ever feel depressed?
All the time.
You feel depressed a lot
I
of
feel
depression.
it.
You ever think about hurting yourself?
No, I don't get that low, but I get low.
You ever thought about trying some medication? So some of the antidepressants actually have an effect in chronic pain as well.
I think about it. Because I have a friend that she used to be so depressed.
Did the antidepressant help her?
She's so much better now. So I've been thinking about it. I just didn't know who to talk to.
So there's a couple of things that we might try. We might try the yoga, and we might also try some antidepressant medication. Does that sound like something that you'd be interested in trying over the next week?
I think it's time.
Good, good. I do too. I do too. I have here the results of your urine drug screen.
Yeah.
What do you think we found there?
Nothing.
Well,
I
we
told you.
found your opioids. Found the
Well,
medicine.
you knew those were going to be in there because I've been taking medicine.
Right, right, and nothing else. So that's great. So that makes me feel really
I'm
good
not.
about
I
you.
don't have a life.
Well, we hope we can change that. And let's see. The other thing is, I wanted to count your pills today. Do you have your pill bottle?
Now that's something I want to tell you about. Okay, so here's what happened. I said to myself, put that bottle by the door, and that way you won't forget it when you walk out the door, and it's sitting on the cabinet, and I know I can tell you that there were like 6 to 8 pills in it. But when I pulled up in the parking lot, I said, oh, got that bottle. So I don't have my pill bottle, but I know there was, I can tell you there was like 6 or 8 left in there.
Okay, so you do have some pills left.
Yeah.
But you did remember to bring them.
Right.
Well, that's a real important part of what we do, because that's one of the things that helps us, again, reassures us that you're safe because you're taking your medicine as prescribed and you're not losing control.
Just trying to do everything right, everything that you told me to do.
Good, good. Well, in order for me to feel comfortable about continuing to write your medication, I'm going to need you to bring that bottle back. Any day that you want to next week, you can bring it and
So
just
I
let
have
the
to
nurse
bring
count
it back before my next visit?
I'd like you to bring it back next week. And the nurse can count it for you and then give it back to you.
I'm just going to bring it, show it to her, and she's going to count it. And then
And she'll
I'm
count
making
the
the
pill.
whole trip for that.
Mm-hmm.
Okay.
And again, it's just we're dealing with potentially,
I'm not an addict. I told you I'm not an addict.
and I'm glad about that.
Okay.
These are just
wanna make
safeguards that,
sure.
as I told you, we use with all our patients to make sure that things are safe for you. And the
You
more-
do this with all your
We
patients?
do this with all our patients who take these pills. And the more reassurances that we have that you're not losing control, and the more comfortable we feel giving you the medication.
Not losing control.
Wonderful, wonderful. So you can bring your a bottle back next week and let
I'll bring it back.
Wonderful, wonderful.
I'll bring it back.
Okay, so it sounds like our plan for the next month would be like this. I'll write your prescription. We'll keep your pain medicine at the same level. I'm going to write you an antidepressant medicine today. It'll be a pill that you take once a day. You're going to try the yoga. What's a reasonable number of times, do you think, for you to go to yoga over the next month?
Well, I mean, I can't go during the week, I don't think, but I can go. I think I can go on a Saturday. I can try. I'm just going to tell you, I'm going to try to go on Saturdays.
Okay. All right. So you think you can make maybe how many times in the next one?
I'm going to try to do. If I say 3, then I might get 2. So I'm going to say 3, and I might get 2.
Okay. I think that would be great. For it to really benefit you, it's probably better for you to get into a routine and do it, say at least once a week, maybe more often. But I think 3 is a reasonable goal. We're just going to keep working together on this. And
my goal is to be getting in shape. My goal is going to be dealing with my pain. What is my goal?
Well, we're hopeful that the yoga is going to help decrease your pain level. I also
Yeah,
have some other
that'd be
goals for you.
nice.
I hope it's going to make your life a little bit fuller and a little bit more enjoyable. You'll be out, you'll be with people, you'll be exercising. That helps a lot of people feel better. So I hope it's going to help some of those other areas of your life in addition to decreasing your pain.
Yeah, that's been a long time. So I'm going to try, but I don't know those people in that class, so I don't know.
But you know one.
Yeah, and
that's
if my
okay.
friend goes
Right.
with me, then
Right.
I can do it.
Right. Okay. Well, I appreciate you opening up with me about these things. It sounds like you've had a tough time over the last few years. And I think we can help you get feeling better and your life to get better.
And I appreciate that, doctor, because you know what? I've been to a lot of doctors, and they love to just write a prescription and get you out the door because they think you're an addict. And I'm not an addict, but I just want to say thank you.
Oh, you're so welcome. I really think we can do something here. I think we can help your life get better. And why don't we keep working together on that?
Okay.
All right, thanks so much. I'll see you
Thank you,
next month.
Doctor.